I'll give the floor to Dr. Tedros, who is accompanied again by Dr. Maria van Kerkhove and Dr. Mike Ryan. Dr. Tedros, please.
Thank you. Thank you, Tariq. And thank you to all those who have joined online. Good morning, good afternoon, and good evening. Although COVID-19 is giving us many reasons to grieve, today we're also celebrating a public health victory. Yesterday, the World Trade Organization, WTO, ruled that Australia's laws on plain packaging for tobacco products are justified and are not unfair restrictions on trade. Tobacco kills more than 8 million people every year, and Australia was the first country in the world to introduce plain packaging without branding in 2012. Several other countries have since introduced similar laws. The tobacco industry has done everything it can to have these laws overturned, including challenging them at the World Trade Organization. Effectively, yesterday's WTO ruling means the tobacco industry has run out of options to challenge plain packaging internationally. WHO congratulates Australia for this victory, and we're proud that legal experts from WHO and the Framework Convention on Tobacco Control supported Australia in this case. We will continue to support other countries to introduce plain packaging as one of many proven tools to save lives from tobacco. I have spoken about humility a number of times over the last few months, and I think it's fair to say that this microscopic virus has humbled all of us. By definition, a new virus means that we're learning as we go. We have learned a lot, but there is still a lot we don't know. Every week we speak directly to countries, the media, and the public so that we can keep everyone up to date on the latest scientific evidence and the evolution of the pandemic. In Monday's press briefing last Monday, my colleague and friend, Dr. Maria van Kerkhove, answered a question from a journalist about the extent to which COVID-19 is being spread by people who don't show symptoms. We have answered similar questions on this topic before. Yesterday, Maria and Mike also held a Facebook Live session to explain what we know and don't know about asymptomatic transmission, and to answer questions from journalists and the public. Since early February, we have said that asymptomatic people can transmit COVID-19, but that we need more research to establish the extent of asymptomatic transmission. That research is ongoing, and we are seeing more and more research being done. But here is what we do know, that finding, isolating, and testing people with symptoms and tracing and quarantining their contacts is the most critical way to stop transmission. And many countries have succeeded in suppressing transmission, in controlling the virus, doing exactly this. This is a new virus, and we're all learning all the time. Communicating complex science in real time about a new virus is not always easy, but we believe it's part of our duty to the world, and we can always do better. We welcome constructive debate, and that's how science advances. WHO's advice will continue to evolve as new information becomes available. We continue to work 24/7 to accelerate the science and learn more about how the disease is spread, what best practice contact tracing looks like, as well as the development of new treatments and vaccines. We will continue to talk to our member states, the media, and the general public about what we know and where there are gaps in evidence and how that's shaping our thinking. We will explain what we know, what we don't know, and what we're doing to find out more. We always aim to be clear about evolving science, and we're committed to accountability for everything we do and say. This morning, I met virtually with WHO's interns from many countries. I was not only struck by their creativity, energy, and positivity, but also how freely they discussed the lessons they have learned. Interns are a vital part of WHO's workforce. Just as they learn from us, we learn from them. As part of WHO's transformation, as you may know, we have been overhauling our intern program to increase the diversity of our interns and make it possible for more young people from more countries to take an internship at WHO, especially young people from low and middle-income countries who couldn't get the chance to join WHO as interns because of financial problems. And I'm really glad to see that the number of people we're receiving from low and middle-income countries has increased, and the diversity of people of our interns has actually improved significantly. We're also working hard to improve conditions for our interns. We now provide interns with health insurance, and this year we started paying interns a stipend for the first time. And it's the stipend which is actually helping improve the diversity, because we're getting people more from the disadvantaged countries. We're committed to investing in young health leaders who will build the healthier, safer, fairer world we all want for our children and grandchildren. I thank you.
Thank you very much, Dr. Tedros, for these opening remarks. We will open the floor to questions now from journalists who are watching us on Zoom. One last reminder that you can do that in 6 UN languages plus Portuguese. If you wish to do so, please be short also and concise, and if possible, have only one question. We will start with the Radio France Internationale, and we have Jeremy with us. Jeremy.
Hi, Tarek. Hi, everyone. Can you hear me?
Yes.
Thank you so much for taking my question. I will do it in French then. Une question qui s'adresse au panel, pas une personne en particulier, mais je voulais savoir, depuis le début de ces conférences de presse, on a évoqué lors de ces réunions beaucoup de risques différents. Le risque d'une pénurie de masques et d'équipements, le risque de super spreading events en anglais, le risque pour les pays africains que la pandémie se déclare dans des pays avec des systèmes de santé très faibles, le risque qu'un vaccin soit l'apanage d'un seul pays et qu'il ne soit pas accessible au plus grand nombre. Je voulais savoir aujourd'hui, de votre point de vue, quels sont ces risques qui sont aujourd'hui, qui peuvent être totalement écartés en grande partie, et quels sont les risques qui restent aujourd'hui, qui pèsent toujours et qui peut-être vous pèsent également, enfin les risques qui sont face à nous aujourd'hui. Merci.
Thank you for the question. I think you've possibly answered your own question with the detail you provided, and I think all of the issues that you've mentioned are issues and it depends, I think, on which part of the world you're in. The issue of PPE for health workers has not gone away. That is still an issue in many countries. It's still an issue in many countries affected by humanitarian crisis. Not only the PPE, but the training for those workers. And we see health facilities now in many, many countries coming under huge pressure and strain. Maybe not in Europe, maybe not in North America, but certainly in Central and South America, certainly in other parts of the world. So I think the risks that you outline are all risks. I think the combination of risks and the priority of those risks is different, as you referred to in places like Europe now. The hospital system has coped with the onslaught of cases, and now the issues are about travel, the issues are around reopening schools, the issues are around risk management, they're around mass gatherings, they're around surveillance, they're around contact tracing. In Southeast Asia, where countries have to a great extent controlled the disease in places like Korea or Japan, Australia and others, the considerations of government there are more around the re-emergence of clusters and how to safely remain open and then have sensitive surveillance in place to deal and jump upon clusters of the disease when they actually happen. If you're in Africa now, and we've seen increases across many countries in Africa in the last week, while the death rates have been very low, there's always a concern that the health system can become overwhelmed. And how is the health system going to cope when you also have malaria, you also have other childhood and other diseases that require care? So I think each and every country has a different combination of risks and opportunities at this point, and it's really down to national authorities to carefully consider where they are in the pandemic. This may be a pandemic, it may be affecting the world, but it's affecting each and every country in a different way, depending on when disease came, depending on how the initial responses were managed, and depending on how the disease is evolving at this point. By no means is this over. If we look at the numbers over the last number of weeks, this pandemic is still evolving. It is still growing in many parts of the world, and we have deep concerns that health systems in some countries are struggling and they're under huge strain and require our support and our help and our solidarity.
If I may add, so just to add on to what Mike has said, there are the risks that are associated with COVID, of course, and Mike has outlined those, but there's also the risks for non-COVID related diseases that we must maintain our essential health services and make sure that we have vaccinations that are taking place among the people that need those vaccinations. Those programs need to continue, and we need to find a way to do that. Another potential risk is the complacency, and as the DG has outlined, we are seeing an acceleration in many areas, and this isn't over. And even in countries that have had the success in suppressing transmission, there is that risk that a resurgence remains. And then the last risk to highlight, I think, is that this dichotomy between thinking that we must have a public health, focusing on public health or livelihoods, like we must do both and find a way where we can find this state in which we can suppress transmission, we can save lives, but we can ensure that people's livelihoods aren't further impacted. So I think that's an excellent question that you posed. It's the right one. It's a complicated one that requires a complicated response from everyone.
Thank you. I think it has been said. Just one thing I would like to say on the vaccines. As you know, WHO is working on helping to develop vaccines, therapeutics, and diagnostics. And as you also know, there was an initiative that was launched by WHO and other partners on April 24. That was followed by a pledging event by European Commission, President von der Leyen on May 4. And that effort is continuing. And the two objectives are, one, to accelerate development of a vaccine therapeutics and the rest. But at the same time, to ensure fair distribution and access to those who need it. And as you rightly said, there is a risk there of, for instance, lack of access to a product like vaccine that we will have in the future. And that's why we had the ACT Accelerator and also the CTAP, which was suggested actually by the president of Costa Rica. And many leaders are now joining to echo the public, to make vaccines or other products as global public good. Meaning there should be a political commitment by political leaders to have a consensus on making vaccines a global public good. If there is no political commitment and political support to make it a global public good, then we will have the problem that you have already indicated. So I would like actually your question to use as opportunity to call on leaders to add their voices. So when a vaccine is discovered, that it should be a global public good, and access to those who needs it be ensured. Because the most important thing in ensuring access is political commitment, and political commitment by our leaders. So that can address the risk that you said, the problem that you said may happen. And that's why we launched the initiative ACT Accelerator as early as possible, so we can break the barriers, one of which is the political challenge we may face, and the political commitment that we need to counter that and ensure access to a vaccine and therapeutics and other products that can help us to control this pandemic. Thank you.
Thanks, everyone. I hope, Jeremy, this answered your question. And now we will go to Brazil. We have Lara Pinheiro from Globo. Lara?
Hello, thank you for taking my question. Can you hear me?
Yes, very well.
I would like to ask for the whole of South America in general. Is the arrival of winter supposed to help the spread of COVID-19, given that most of the respiratory viruses usually spread more in this time of the year in this region of the world? Thank you.
I think historically what we do know is that influenza viruses have a northern-southern hemisphere cycle, and we do know we're entering the cycle of the southern hemisphere influenza season. What we don't know is how the coronavirus is going to behave in the same situation. And certainly there are different parts of the southern hemisphere. There is the temperate south, the countries like Australia, New Zealand, South Africa, Chile, Argentina, which would experience an influenza season, much like a winter season in the north. And then there's that central equatorial region in which influenza behaviour is not that predictable and tends to persist throughout the year. So there's that, even looking at influenza, it doesn't behave in a particularly predictable way within the equatorial regions. Right now, we have no data to suggest that the virus will behave more aggressively or transmit more efficiently or not. The other question arises with the viruses like coronavirus is in the European environment, many people would argue that influenza virus is less transmittable in the summer because people move outside, there's less mixing, there are less closed environments with many people allowing the disease to spread. But you could also argue in other hot climates, especially with the advent of air conditioning and other systems, that people tend to move inside during hot weather because the weather gets too hot. So there may be risks that are driven by both by climate that aren't specifically related to the viruses themselves, but are more specifically related to the human behaviours that are driven by temperature or driven by the season. But at this point, just to be clear, we have no indication as yet as to how the disease will behave in future. But in terms of South America in general, we're seeing an increase in cases across Latin America, and particularly in South American countries. And each week I've spoken to this. We've seen a persistent and progressive increase in cases in Central and South America, and it is of deep concern. And we need to focus on containing and stopping and suppressing that disease. And if changes in the climate assist in that, that's great news. But we cannot rely on an expectation that the season or the temperature will be the answer to this. It is not the answer. We need to focus on the public health measures, the social measures, the hygiene, and all the things that Maria speaks about and emphasises again and again, to continue to focus on those comprehensive public health-led strategies that have proven in many parts of the world to be able to contain and suppress transmission of this disease. Maria?
Yes, so I just wanted to highlight our influenza system that we have globally, that we're working with so many member states, so many different labs across the globe, which I would be remiss to highlight that we are building the work that we're doing for COVID-19 upon, as well as the work that we've done for MERS and the work that we've done for SARS. But the influenza network in particular has been in operation for decades. And the labs that are utilized across the globe are the foundation by which we are able to test for COVID-19. And so the Sentinel system that is in place to look for influenza-like illness or severe acute respiratory infection exists in many countries across the globe. And more than 90 countries right now are utilizing their influenza system to also test for COVID-19. And so this is incredibly helpful for us to build on that platform so that we understand where the virus is within the community, aside from testing for suspect cases. But it is critical, and the question that you highlight about the influenza season coming up in the Southern Hemisphere, it's important that we don't stop testing for flu. We must continue to test for flu as well as to test for COVID-19. And we know in a number of countries the tests for flu have declined. So it's very important that countries remain and utilize their systems not only for COVID-19 but also for influenza. And we are so grateful for so many labs across the globe, the surveillance systems that are in place, for the hundreds of thousands, the millions of people that are actually working on this to help us understand where not only COVID is, but where influenza is, because we know that there will be an influenza season every year. We need this information for vaccine development, so it's really critical that these systems remain functioning well in addition to COVID-19.